The body has an innate ability to heal itself. And that's what it's trying to do. It is really trying to heal itself, but it is running into some insurmountable barriers. So all we have to do is assist it.
Welcome to Heal, a podcast about the real stories of what it takes to heal. I'm your host, Dr. Sarah Marshall, naturopathic physician, published author, and psychedelic integration guide. What does it really take to heal? We sit down for raw, authentic conversations from science to spirit, trauma to transformation. If you want to learn more, go to my website, sarahmarshallnd.com, and sign up for my newsletter, where I share my most cutting-edge new thinking, what I'm seeing right now in the research and in my clinical practice. So you're getting the most up-to-date information, practical tools in your inbox. Check us out, join us, and enjoy the show. Well, this is very exciting. I'm so glad to have Dr. Anju Mathur with us. Really couldn't be a better person to kick us off because you have 20 plus long years of working inside of advanced integrative functional medicine. You're the pioneer of an anti-aging medical clinic, visionary behind Angel Longevity Medical Center, and really bring decades of experience forward in some very difficult territory of treating chronic disease and like actually being able to reverse illness in a way that conventional medicine just doesn't touch. So I'm thrilled to have you here.
Oh, thank you very much, Sarah, for having me on your first video podcast. This is exciting.
Yep, we're kicking it off. So I want to just dive in with, how did you get here? You know, what was your path to functional medicine?
Yeah, like as we were chatting before the podcast, it is a personal journey. Literally, it is a personal journey where you take not only yourself, but the others with you. And that's really how it evolves. And I've seen that, routinely, even in other physicians' lives. When you're younger, you kind of do what young people do. When you get older, you kind of try to do how do you, and because you're in the middle of the medical, industry, then you are kind of trying to find out what you could do to help yourself. I'm sorry, sounds selfish, but it is true that when you yourself as a physician get into a situation where you are in the soup and you don't know how to get out of it, and whether it's aging or it's an autoimmune disease or whatever it is, you have to find the right answers for you to feel well again. So if I don't know how the mainstream physicians are doing, because I'm sure they're feeling the effects of aging themselves, and how they kind of ignore. I have no idea how that works, but maybe they're satisfied with treating other patients. I'm not sure. But for me personally, when I was like 40 something, and it was in early 40s, and I got into a place where suddenly I couldn't really do things that I would normally do, like even going to the office or going for a walk or exercising. I used to be an exercise fiend. Like I used to love exercising. I would be doing all sorts of exercising. Um, and I couldn't do those. And I used to spend most of my day in bed trying to get enough energy to get out and actually do even house chores, And that was kind of not my scene, my ideal scene. And I was like, okay, what do I do to get out of it? And of course, I consulted some of the mainstream doctors in the beginning to try to see, okay, what is the problem? And most of the time I got the answer, there was all the tests are normal. And the standard tests that are done by the mainstream are done basically to find out if you're really dropping on the floor. So those tests become abnormal just right before you get into a situation which is like very severe condition that you now need to go to the urgent care or to an emergency room or something like that. One doctor was saying that those tests become abnormal 10 minutes before you die. So
That's
in other
very
words,
similar to something I say, where it's like we have health and we have death, and then most of the time we diagnose disease just slightly to the side of death, and that's what we're dealing with all down here. And you and I work in this entire range in between.
yeah, exactly. So that's well said. Literally, that's what it is. So, for example, your liver function is not going to become abnormal until you really have a liver situation. And that's what I tell my patients, even if the enzymes are elevated slightly, and I say, look, the enzymes are elevated in the blood slightly, but that's just the beginning. So this is the time for you to now fix it. So there is no problem going forward. But the normal, usual doctor would not pay attention. They say, oh, it's okay, whatever. Even pre-diabetes, they don't really take up pre-diabetes. They just say, oh, don't worry about it. Like just yesterday, I had a patient that had pre-diabetes, and he showed me all his tests, and I said, oh yeah, you look like you have pre-diabetes. He says, wow, really? And nobody told me that. They don't tell you. So even the patients who are like being treated, let's say they're being treated for diabetes, they get satisfied if their hemoglobin A1C is at 7. And
Which
they're
is way
satisfied.
outside of the range you and I would actually
Way
consider.
outside,
Yeah.
yeah.
Yep.
We are targeting 5.2.
Exactly.
So there's a big disparity between the mainstream, what they expect, and what their standard of care is way outside what we consider as preventive and wellness.
And optimal. Yeah.
And
High
optimal.
functioning
You want
optimal.
totally, you want to be in optimal health. You want to feel well. Not that I don't have a headache, but I feel well. And that's what we are targeting. You and I, we are targeting wellness. We want you to feel well, like jump out of bed in the morning, excited about what you're doing, not have to worry about anxiety, depression, whatever it is, fatigue, irritability, mood swings, or sleep problems, whatever it is, those should not be there. So you can live your life to the fullest extent. This is the purpose of my clinic. I want you to live your life to the fullest, and that's my target for you. And that's how we do it. So personally, yeah. So coming back to the story, my personal story, so I had no energy. I couldn't even sleep well, and I would wake up tired. I couldn't do much, and I had to lay down in bed most of the time during the day, which is so like acceptable for a person who's like running 100 miles an hour and being productive. You don't have time to lay in bed for 10 minutes or half an hour or whatever. It doesn't even make sense. So I kind of dug deep into it. I said, okay, where do I start? Because obviously the mainstream doesn't have an answer. And I was mainstream doctor. I was doing mainstream medicine, and I was kind of dissatisfied with it as well, because patients, even though they personally liked me because I'm a personable person, but they were coming back with the same problems over and over, and I was just prescribing medications. And I realized that my patients are not coming back to tell me how great they feel. They only say, okay, now, I just need the refill on the blood pressure, arthritis, whatever, diabetes medications. So combination of the personal and also professional experience led me down this path of finding out the answers and to the questions that we all have. But then I looked at it, I said, you know what? That's not I need to learn the real medicine, because people are counting on me. I can't now turn my back and say, you know what, I can do it. And then I got hit with this personal health crisis where I had to figure out what to do. So when I went through the whole process, I actually started with nutrition, believe it or not.
Mm-hmm.
Because as a physician, you don't get training, too much training in the medical school. And to tell you the truth, it's about a couple of hours of training.
We had 3 years of nutrition in naturopathic school.
Yeah, that's what it takes to understand what it is that you need to do. And literally, the medical doctors, they get about 2 or 3 or 4 hours of training, and that even in ADA, like anti-diabetic diet. And that's about it. So, or maybe renal failure. Those are the things that we get trained on. But literally, to improve somebody's life, improve their metabolism, improve their working, the efficiency of the cellular metabolism, none of that is being taught. So I had to dig myself deeper into what it is. So first thing I actually did was the nutrition. I wanted to find out what is the right nutrition, because there's so many conflicting theories out there that the person can like spin like this, because they kind of say, one person says, oh, meat is really bad, oh, you should be plant-based diet. And the other guys who are doing carnivore diet, oh no, meat is the diet, meat is what you need to eat to keep yourself healthy. So it's very conflicting. And that's like, so I was like, as a doctor, I had to get some evidence. I needed to experience what I'm doing. So I ran into this system called metabolic typing.
Mm-hmm.
And that made sense to me because now you can figure out the person's own metabolism and find out how the body is handling the food. And that way you can determine. So it's not like the food is bad or good. It's not like, oh, the meat is all bad. No, it's not. Or the plants are not good. Either way, you look at it, there's extreme opinions. But I believe that you need to find out what kind of metabolism do you have and what kind of foods are correct for your body. So it's very personalized. And so that's what I'm doing. I've been doing that for a long time and I love it. And it's never a time when the person disagrees with what it is. Maybe one out of last 10 or 20 years. So it's very rare the person says or disagrees with what they should eat. And literally the patients say, you know what, I knew that.
That happens a lot. Their own intuition, their own sense of things, and then you're able to validate it. And it's like, I knew that felt good. I knew that's when I feel the best. Like they have that inner sense.
Exactly. People know it
Yep.
because they are the ones that are living in their bodies. So they do know what the body does, when the body does well, when the body doesn't do well. They really know that because they're living in it.
Which is
Every
another
day.
deviation from a lot of conventional medicine and allopathic medicine where doctor knows best and the patient doesn't know their own body and they can't be trusted inside of their own experience versus flipping that on its head and actually coming like, I mean, my approach is always if my client comes in and has a strong sense for something, I'm going to pay attention to that. And just like, at least we'll go do laboratory and we'll back it up with evidence or we'll explore down that road. But like, people have remarkable ability to tune into their bodies. And if anything, that's the pathway to healing is to tune in even more.
Exactly. Because the one philosophy that I treat my patients on, and I educate them on that from the beginning, is that the body has an innate ability to heal itself. And that's what it's trying to do. It is really trying to heal itself, but it is running into some barriers, insurmountable barriers. And that's why you're in my office, because the body's not able to do it. So all we have to do is assist it. And
So
if we
now here we
assist,
are, and we're working through this phase. We've got metabolic nutrition starting to come in, and
yes,
you guys offer quite a plethora of different opportunities for intervention to healing. You have stem cell therapy, peptide therapy, bioidentical hormones, IV therapy and infusions, ozone cryo, chelation. I mean, you guys really have a very comprehensive approach. So how do you go about like figuring out what somebody's needs are? What would be some of the examples of when you would apply ozone versus cryo versus peptide therapy?
wow, that's a very loaded question. It's it's like a clinical teaching here, but literally, the my philosophy is to start from the basics. So nutrition is always the basic, no matter what you're dealing with, whether you have an autoimmune or you have a cancer or you have any other chronic illness, you are feeding the body wrong. Otherwise, you wouldn't have this much of a trouble. You may not feel well, but at least not this much. So I feel that in terms of healing, you have about 30% of the healing can occur with just nutrition. So we probably find out the personalized nutrition, we start from there. Then, of course, we find out, I mean, depends on what the disease is, right? You want to find out what is a problem. But what we do is we do go through all our philosophy is systems biology. So we are actually addressing different systems. So we want to address your circulatory system, for example. Is your circulation good? Or is that your gut is a problem? So I will order the test that are appropriate for that person and based on their personal history and their timeline and their family history. So that's all. You have to kind of put the whole person in a perspective in their environment because and so actually that brings me to this point that a person is not an individual separate from the environment. You can't just say, oh, this person has a disease. No, this whole environment in which he is existing has created this unwellness sort of picture for that person's body. But it has all the different factors. So we look at all the epigenetic factors to find out why the genes that are turned on, they're the ones that are not in favor of the person, and why the good genes are not being turned on. So nutrition is absolutely the one main thing. And then you go into the gut. So the immune system, as you're getting older, the immune system is a big problem for people because that kind of goes off the track. So it's not really doing what's supposed to be surveilling for pathogens, surveilling for cancer cells. It's not doing that anymore. And that's why you get your cancer and you get your autoimmune. So we want to address the immune system. Actually, I want to give you an example of this. One time this was in the beginning when I was just turning I was pivoting into the alternative and in functional medicine. I was learning about it. I didn't know anything about it. So I had to go to the conferences, learn and listen to the other doctors, what they were doing. And so I kind of was learning about bioidentical hormones. And they are so amazing. They are like all the effects that they produce on different cells in the body. And what they do is amazing and mind-boggling. So I thought, wow, this is great. I could do this. But then I get a patient who is being seen by another alternative medical doctor and who is taking all the hormones. Literally, he was on the 10 different hormones and he told me he can't get out of bed. And I said, wow, that's interesting. I just learned about the bioidentical and this is what's happening. So there's something missing. So that's how I progressed from one therapy to the next and the next and next. But in the quest for finding more solutions for different complex situations. So that with that patient, and that was early on, I learned that it's not just the hormones, it's the rest of the body. And so I treated his immune system. So that's when I got into IV therapy and everything, boosting the immune system. I think for him, it was mostly pro-oxidant therapy, your ozone and your vitamin C. When the vitamin C is given in high doses, it's pro-oxidant therapy. When it is given in low doses, which is where the hydration plays it, they do low doses of it, and that is antioxidant. So I learned about these things. So I gave him that treatment. And 2 months later, he was running a marathon. And so that's how I learned. I learned by doing all these things with the patients. So
They
patients
teach us.
Yeah, they teach us so much. They gave us the opportunity to try. And I told him, look, I have never done this, but I'm going to do this. He said, yeah, go for it. Help me. Because they've tried everything else. I mean,
Yeah.
what could they lose, So that's how my practice grew from one therapy to the next. And I always tested everything on me first. And before I would offer it, because I want to make sure if I survive, then probably I can give it to others.
And also to just know the experience of it. And, with some of these therapies, there can be a period of time of either die-off symptoms or detoxification symptoms. And you have to kind of work through those levels of trust that you have to have with your physician to know this will improve, but we actually need to liberate the robbers out of the house, is the way I put it, and work through that. There's lots of ways to turn that down, to go slowly, to support it with other nutrients so that it's not as severe. But that very much as a part of the healing process is there's some work to be done. It's not all just I'm going to feel immediately better the next day.
Oh my gosh, that I have another story for that. And that actually changed my practice overnight when that experience happened with me. So that was when I did the liver detox. Right? I did the liver detox, and that was 7-day liver detox. 5 days was preparation, and 2 days was a detox. So I did it on the weekend because I didn't know what to expect. First of all, detox is a completely foreign word for a medical doctor. Like I don't even know what that means. And it's kind of strange because you have been taught the physiology. We all know how the liver detoxification pathways work, the biotransformation phase 1 and phase 2. We all know that, but we kind of put it on the back burner, and then we get into pharmacology. As we graduate from medical school, the last couple of years is pharmacology and the side effects and the adverse effects and the combination of drugs, all these things. So we kind of lose track of it. And so when I did this detox, I was obviously skeptical. I'm like, whatever. But my nutrition person that was advising me on nutrition, she told me, Anju, it's time for you to do the detox. And that was about a year into the nutrition program. And then when I did the detox, I was like, the actual day of detox, I went to bed after I did everything. In the morning, I was so tired. I couldn't get out of, I did drag my, literally, I was sleeping the whole day, the next day. But the day after, but even that feeling of when you're going through something, it's a good feeling.
Yeah. You kind of
You know?
know. It's like some part of you knows this is the right thing.
Yeah, it's not a bad feeling. It's more like a feeling when you're coming out of a sickness. Towards the end of your flu, when you finish the flu and in the end you're kind of getting better. It's how you feel when you do a detox. So the next day I would just be lying and, all day, and I would eat and I would go back to sleep, eat and go back to sleep. That was like 24-hour long. And then the following day, I felt like a new person. And then not only I felt like a new person, I saw the gallstones coming out, in the bowel movement. And when I saw that, I say, okay, that I cannot deny. I can see these things coming out. I can't say I didn't see it. That doesn't make sense. And then the fact that I felt so much better, that's when I decided. That was like a moral decision that I had to make. And I said, you know what? I can't keep this as a secret from my patients and keep giving them medications after medication and not get them to understand that there is a natural way. So the next day I came into the practice and I told my patient, I said, this is what I did and it's fantastic. And the response? Tell us about it. We want to do it. Because patients want to heal themselves. It was so warm to see that thirst for the good thing, for
I
healing.
think that's another fallacy that gets passed around in medical conversations too much, that patient compliance is your biggest issue and people only want a quick fix and they'd rather have the medications. And I disagree completely. I think the majority of people, if you take the time to get to know them, and that's the key thing, is you have to take some time, but you'll find that everyone is actually looking to truly heal. They really want to be free of it. And they're looking for the information how to go about it. They just don't know. I mean, sure, there's times when it's so much pain or it's so acute, they need something to just get them through that moment. But if you do that work and also educate them on what the long term is, I find that really is what people are looking for.
Oh, absolutely. I mean, there is a place for mainstream, which is basically ERs and urgent cares.
Mm-hmm.
If you didn't take care of yourself or something catastrophe, you get into an accident, you definitely need to go to ER and you need to handle it. But anything that's chronic,
Yeah.
you need
And
to.
after the car accident, then come see us.
Yes, after yeah, absolutely. Heal yourself faster. Absolutely. We have all kinds of peptides, everything, to heal you faster. But like if you're dying of a heart attack, okay, you do need to go to ER and just survive the heart attack. But the fact that you got the heart attack means you didn't take care of yourself for 20 years prior. And so now we have to fix that problem. But we can still do it. It doesn't take very long. And some people think the other fallacy, other misnomer and the misconception that people have is that natural treatments take too long.
Mm.
And it's not true. It's not true at all. Some patients have been seeing doctors for years and years and years. They're an alternative. They're doing acupuncture or nutritionist or chiropractor or whatever, but they have been doing it forever and it doesn't resolve the problem. So that I disagree with, because if you handle the right things in the right order, you should be able to resolve it. So usually my programs, I only give them about 4 to 6 months to get well. And that's it. You get well and you get well. That's about it. So they agree with it. They say, yes, this is doable. So obviously it's not overnight. It's not overnight. You're not going to do it overnight magic, even though that has happened many times. But that, I wouldn't say that's a norm. But I would say it is a gradual improvement. You should see gradual improvement. If you're not seeing the gradual improvement, the right thing is not being addressed.
Yep. Agreed.
And so you need to find the right thing that needs to be addressed, and you do that, and then you should feel the gradual improvements, and then you should reach a goal what's your goal? of the treatment. And so usually I give about 4 to 6 months. Rarely it takes another 4 months, but that's it. 10 months, I don't have. So the one other thing I tell my patients is I don't have patience, but I have a lot of patience. So
Understood.
if you can work with me, going 100 miles an hour, I will do that for you.
Yep. Good.
So don't think that there is no solution. First of all, there is a solution. And the second thing is you can get there fast. It doesn't take years. Years is not in my dictionary.
I love it. So one of the things you said earlier was also about how there's the environment that the person is in and how important that is. And I have kind of a big question for you, which is, what do you see we most need to address in the world or in our culture to deal with this epidemic of chronic illness? Like, where do you see some of the roots are in greater society?
Oh my God, just like a beautiful, loaded, fully loaded question. I have so much to say about that because I think the reason that we have an autoimmune epidemic especially in the US, I don't know about the other countries as much, but in the US, is skyrocketed in last, I would say, since 1970s. So that's about 55 years. So over half a century, it has skyrocketed everything from autism down to multiple sclerosis, Alzheimer's. I mean, you can see there's Crohn's disease. I mean, younger and younger people are getting rheumatoid arthritis. I have a now 26 years old patient with a severe rheumatoid arthritis. And so this is like growing out of proportion to what should be happening. And I don't think it was a commonplace at all. Now you go anywhere in the stores or market or malls and you see this autistic child, that is grown up. It's 9, 10, 12, 20, 15 years old and they're running around. And I'm like, wow, this has become so commonplace now. Why is this? What is going on? So, I mean, there's a whole slew of things, but the easiest thing to pinpoint is the food. The food is disaster in this country. It's disaster because the way the food is processed, first of all, how the food is cultivated, right? How the food is cultivated, how much Roundup is being given to them, and how much sprays and insecticides and the pesticides and the GMO. The seeds are GMO'd, so when the plant grows out, it's a GMO plant. And so they can be resistant to the insects and the pests. That's
And one
how
of
they
the
are
things that
grown.
I've been learning more about is there's the toxicity of the insecticides and pesticides and herbicides themselves, but also the way that those chemicals work with the plant themselves reduce the plant's ability to uptake nutrients. So not
Yeah,
only is
100%.
there a toxin present, but it's a less nutritious plant because there's less ability to pull up the minerals and pull up and actually have the nutrients present in the plant by using those GMO products.
For sure, for sure. I mean, the whole scene is disastrous. The food that comes out, it looks like food, but it's not really food that the human body can actually consume and get the nutrition out of it. The soils are leached out. They are actually toxic. There is a lead toxicity in the soil everywhere. So no matter where you grow, what you do, there is lead there. So people are getting heavy metals from the food that they are eating. Not only the people are getting it, is the animals getting it too. So all the cows that are going to be grazing, hopefully on the grass, then even then, the grass is not taken care of, and the grass is sprayed with whatever insecticides and the pesticides, and the cows are eating that, and through the cows, you are getting it. So it's a vicious. This is why I said the environment where the person is needs to be addressed as much as the person himself. So that's the food and the water. So the water is also, fluoride is now banned in some of the states, I know. So fluoride is one of the things because fluoride displaces the iodine. So fluoride, fluorine, and chlorine and bromine. And those are the things that will displace the iodine. And then iodine is necessary for your thyroid hormone to be produced and converted into active thyroid hormone. So most people, 90%, in my viewpoint, 90% of my patients are hypothyroid and they're functionally hyperthyroid. That means the overall status of the thyroid metabolism or thyroid status is underactive. So they have gazillion symptoms because of that. Yeah, I mean, you have to clean up your whole environment, at least kind of. It's very interesting because it is planet wide, and for definitely in this our country, it's a big, large scale. And then you get on top of that, you have fast food chains, right? You have fast food. People do eat fast food. They say, "Oh, In and Out is, we just eat In and Out." I'm like, "What? Is that not a fast food?"
I know there's kind of a California thing in particular where they're like, that one
Yeah,
doesn't count. That's not really
right.
fast food. It's too
Literally,
popular.
literally, they are
Uh-huh.
convinced that it is. I'm like, no, it is. Come on, well,
Mm.
fast food means there is chains everywhere, and then they speed up the processing of the food so you don't have to wait more than 2 minutes. So that processing itself is harmful to the body because of the alteration of the chemical structure. So first of all, you have a bad food, and then you have processing on top of it.
And then the way it's cooked, and then the oils
The
it's
way,
cooked in.
right. So it's a whole disaster.
Is
I just
everyone
look at it.
depressed yet? But it's important. Like, one of the reasons I like to have these conversations with my clients is that I think there's a disproportionate amount of personal guilt around I'm just eating too much or I'm eating this wrong thing, and that there's a lot of like internal shame that we process. And I don't want to make it sound like it's inescapable, because there are choices you can make to improve the quality of your food, and there are ways to go about it, but it is a bit of a lifestyle change to go seek out those healthier foods and to learn to cook at home and to be willing to take the time to slow down those processes as much as you can. But I think that having a bit of a perspective of what's going on the cultural level is also recognizing that it's not just that I messed up and this is, quote, all my fault. There's more to it, more complexity to it than that.
For sure. Yeah, that's for sure. This is what I say. It's so much advertisement, so much commercials about food and the drugs and all water even. There is so much commercialization of all of these, and then the marketing. Marketing drives. I think In-N-Out Burgers did great marketing to take themselves out of the fast food category. I think that's
Mhm.
amazing marketing.
Yeah.
That people think that, wow, this is not fast food. This is the best food. I mean, including my son. He would tell me, Mom, it's just In-N-Out Burger. It's the best burger. It's very healthy. I'm like,
Yeah.
what? I mean, now he's off of that, but I remember the times because this is marketing. I don't know what they're saying in their commercials, but I've never seen the commercial of In-N-Out, but I'm sure they're saying something about their beef, how great it is, or whatever it is. But I mean, now yeah, so there is it's like you have to get involved. You have to get involved in terms of the way you live your life. You have to take charge. You can't expect somebody else to make you healthy. That's not my patient. And my patient takes charge. They take things under their control. They control the environment. They want to control the environment. So all I have to do is educate them what to do, and they do it. So you can't be healthy unless you take charge of your own health. There's no way.
Well, that's a mic drop right there. So, as we kind of wind things up here, what do you see are those most important steps for people to take? I mean, I have a sense what you're going to say here, but as you're working with new patients, for sure you take on the metabolic typing for their food and nutrition, but those basic things that you find like this will make the greatest impact overall. Maybe they don't have a physician in their area that's doing peptide therapy. Maybe they don't have access to IV therapy. I mean, California, Oregon, Washington, Utah, Idaho, there's huge amounts of natural and alternative medicine available. But all along the Eastern seaboard, it is still very distinct from that. And it's much harder for people to access some of the ozone therapies and things along those lines. So, where would you send people to go to make that difference in their health now?
Welcome to California. That's the
That
easiest
too.
thing.
Yes, you might
I
need to, and
have,
it makes a difference.
yeah, I mean, I have patients that travel from all over the United States to come to LA and they stay here for a few weeks. But outside of that, I would say the biggest change that you can make in your life is to remove, don't ask me all the reasons why, but I see this when I work with my patients, is that I think 80% to 90% people are sensitive to gluten and dairy and sugar. So if you can get yourself off of dairy, sugar, dairy, gluten, dairy, and sugar, you're going to make a big impact on your health. That's very clear to me after treating thousands of patients. So, and I do a lot of food allergies, a lot of food sensitivities. So I know, and if that's not resolving to a significant level, remove the eggs. Remove the eggs and then see what happens. At least you have begun, what I call it, a U-turn. You're taking a U-turn. Right now, if you are going downward in a downward spiral and your health is spinning out of control, then first thing you can do is just change your breakfast. Just change your breakfast. Just not eat the wheat, the granola that has wheat in it, or the bread that has wheat in it, and start from a morning shake with, let's say, vegetable protein, not the whey protein, but the vegetable protein, and see how you do with that. You can make the one change. Let's not jump on 100 changes. Let's do one change and see how you do with that. And then you take the next step and the next. Clean up your environment. Just plant some house plants just to clean up the air. Just very simple things you can do. Plant a garden. You can plant, like I just planted another of my vegetable garden in the backyard. And I'm like, I'm going to do this. And so we bought the little plants and I made sure they're non-GMO, because the nurseries will sell you this beautiful looking plants, but they are actually GMO. So you don't want to get those. And the non-GMO label is on the ones that are non-GMO. So I got all of those, it was fun. So just doing your own gardening, it gives you a little bit of control over your life. You're not like a leaf in the wind anymore. You are taking charge of your own health.
That's great. I love it. So how can people learn more from you or work with you or get more access to your knowledge?
Yeah, you can go to the website. We have quite a bit of information on the website. It's called angellongevity.com.
Great. It's perfect. And you can fly to California, which sometimes is really required. You got to find the right doctor and then you can actually solve the problem.
Yes, I have patients coming from everywhere
Yeah, I
in the
bet.
US. Yeah.
Well, Anju, this has been absolutely magical. I so appreciate your knowledge, your wisdom, your passion. I love when things that I share with my clients are coming out of other doctors' mouths. And so it was very reaffirming and just awesome to have you here and continue to spread the healing knowledge.
For sure. We are on the same bandwagon. We really are passionate about bringing real health to people. So I appreciate you. I appreciate you doing the work in your area and helping people.
Thank you for being here. This conversation is your invitation to remember that healing can be messy, hard work, and also beautiful. Stay connected. Join my newsletter at sarahmarshallnd.com or through the link in the show notes. Until next time, keep asking the questions that matter, and you will find your own path to healing. And of course, a special thanks to my extraordinary and generous guests, my producer, Joshua Watherston, video editing by Nellie Dawson, artistic graphical design by Amy Pruitt, and music by Roddy Nikpour. And as always, thank you for being here.